On a daily basis, we encounter people who tell us that COVID is a thing of the past. Personally, I don't think COVID is gone. I also think that because it is legally a notifiable disease, it must be reported not only to the Department of Employment and Labour or to the Compensation Commissioner, but still to the Department of Health. This requirement is still 100% in place. The Code of Practice was introduced in February 2022, and in labour law, as long as we require this as a working condition, the Code of Practice must be followed. We can ask ourselves, is COVID in the workplace still relevant? Previously, pandemics have ended when people no longer count the fluctuations in cases as large enough to merit calling it as such. Coronavirus has never been going away, and people will inevitably continue to die, albeit in diminishing numbers. The epidemic is not really over. There are still a lot of people who have COVID and dying of COVID. So the virus has not gone and is not about to disappear either. We are still bound by legislation. The one is that COVID-19 is still a notifiable disease, which means that our legislation prescribes how we must deal with suspected cases, testing protocols, reporting protocols, isolation protocols, and management protocols. That is still in place. This has not been discontinued. So, if you have a symptomatic person in your workplace, there is a code of practice required which employers have to comply with. It remains relevant from a legal and occupational labour point of view. Should we not manage the SARS-CoV infection in the same way as we manage colds and flu? The COVID spreads more easily, and we have this long COVID, so no, it cannot be managed in the same way as flu. There is also the possibility of further variants. You have probably asked if there is still a need in terms of the broader framework of the Occupational Health and Safety Act and COVID to, for example, still wear a mask in the workplace. Section 8 of the Occupational Health and Safety Act requires us to establish what hazards exist in the workplace and to put measures in place to mitigate those hazards. So it is difficult to say that persons in the workplace must wear masks unless the organization's risk assessment has identified a risk of COVID. The risk assessment is still a requirement, but perhaps the risk assessment reveals that wearing a mask, which was a minimum requirement, is not necessary. In addition, one must also bear in mind that according to the risk assessment, there are other control measures required like ventilation, and that employees must not be lumped together in one place. There are other respiratory diseases, not only COVID, so the control measures may still be applicable. The employer will need to check to see if the control measures which were applicable during COVID are still a factor. Of course, workplaces differ, so it's difficult to say that mask wearing is a requirement, so the result of the risk assessment must and will determine what control measures must still be put in place. If an individual feels that they must wear a mask, then that person should take on that personal responsibility, because the Act still says you are responsible for your own safety and others, especially if you know you have some symptoms. Some of the World Health Council still make it ethically compulsory for medical personnel to use respiratory protection during their work. So what should a workplace risk assessment consist of, and why is it important? There is no prescribed format for a risk assessment. The workers, the health and safety reps, safety professionals, employers, HR staff, are key role players in the risk assessment development process and input. It depends on what has been identified in each discipline and the type of work being done. In terms of the risk assessment, even other persons coming into the workplace must be considered. The risk assessment must reflect the ranking of the risk and the action plan or the hierarchy of controls which needs to be implemented. Risk assessments should have been updated since the national state of disaster was lifted. We essentially have 7 pillars of legal requirements, and the COVID risk assessment and COVID plan must still be in place. Number 1, there must be a management structure for vulnerable workers. There must be some form of COVID-19 access control for employees and people who are not employees who may be infected. They can be Section 8 employees or Section 9 people who are not employees. Ventilation requirements. The recommendation is 10 to 12 litres of fresh air per person per second. Number 4, COVID communication to workers. This must be prescribed in the protocol. Case management must be maintained. We must still identify workers with COVID and report accordingly. Number 6, workers' duties must be defined in the Code of Good Practice. And then finally, we must have a return to work assessment of someone who has been off with COVID. So what is the Code of Practice? A Code of Practice is a standard of how to deal with a specific hazardous biological agent. The Occupational Health and Safety Act and the Hazardous Biological Agents Regulations is but a wide framework for the health and safety for employers and employees in a workplace. This is where one would go to find the specific detail of how one deals with the SARS or COVID in the workplace. The Code of Practice gives you the manual on how to deal with COVID in the workplace, which will include everything just mentioned and more. So ask yourself, are employers obliged to implement the Code of Practice? The Code of Practice is a practical risk control standard, a bit like a SANS code. Because it's not law, like an act or like a regulation, if an employer deviates from the requirements of the code, then that employer would have to present good reasons why they have deviated. The code is applicable to every employer. The code has a special requirement for employers with less than 20 employees. If that applies to you, then have a look at Section 13 of the code, which is a reduced requirement for those smaller employers. The Code of Practice has 3 chapters: the introductory provisions, the risk assessment and plan, and then finally the administrative measures. In your risk assessment, you could identify 5 different areas of hazards. Number 1, health hazards. Number 2, employees' social hazards. In other words, employees might have sick persons at home or might not always be paid. They may be working from home or have to work from home. Number 3, some employees may have financial hazards. There could be unpaid absences, reduced work hours, no work, no pay. Number 4, the employers too may experience financial hazards in dealing with the controls of COVID. And number 5, the psychosocial hazards. COVID-19 fatigue, burnout, working from home, polarization, mandatory vaccination, and so on. You should have already produced your risk assessments during the height of COVID. But now you should be going back to those risk assessments and revisit those assessments. So you could use and implement these 10 steps when preparing your new risk assessment as per the code. Number 1, it is a legal requirement to have a competent risk assessor. Number 2, identify the hazards for example, as per the 5 different hazards on our previous slide. Number 3, what is actually causing the hazardous events? Number 4, assess the risk probability and severity and identify the risk ranking. Number 5, how do you prevent the hazards in the workplace? For example, working from home, maybe by vaccination. Number 6, engineering controls, for example, ventilation, screening, etc. Number 7, we have administrative controls like access control, social distancing, sanitation, dealing with vulnerable employees. Number 8, how are these controls reducing the risks? Consolidate the original raw risk and reassess the probability and the severity into what one considers now to be the residual risk, then to decide if this is an acceptable risk. Number 1 is an overall consultation with the employees during the implementation, inspection and measurement. Number 10, have a regular risk review. In terms of Section 25, if a GP has diagnosed COVID, then it must be reported to the Chief Inspector. Then also, for compensation purposes, it must be reported to the Compensation Commissioner, thus complying with both the Occupational Health and Safety Act and the COIDA Act. What we are dealing with is a massive inflow of non-conforming actions by clinics and doctors. And we are seeing people coming back to work after 2 days or so with annotations of absence due to upper respiratory tract infections or flu. But then those people have not been tested for COVID. Their sick notes are issued and submitted to the employer. On the issue of the sick certificates and the question of key points around vulnerable workers, that's not correct because COVID is a notifiable condition. So if a person presents with COVID symptoms, described as sore throat, upper respiratory form of infections, coughing, fever, typical symptoms which are outlined in the protocols for notifiable conditions, that person must be tested with the Department of Health protocol. The protocol has not been updated since February 22, but it still remains exactly the same. That person must remain in isolation until the test results are available. If the test is negative, then that person indeed would have had flu or an upper respiratory tract infection. If the test is positive for COVID, that person must isolate for 7 days, starting at the onset of the symptoms or longer if the doctor prescribes longer. Asymptomatic persons who test positive do not have to isolate, but the employer must identify if they want people like this in the workplace. That depends on the workplace risk assessment and what percentage of vulnerable employees there are, and also what percentage of vaccination there is. Quarantine of close contact is legally no longer required. So when an employee arrives with that kind of certificate, the employer has 2 choices. Either he sends the employee back for COVID testing, or he requires the employee to stay off for 7 days. With regards to vulnerable employees, we must consider 4 facts. This is a sure way of preventing other possible pandemic. Number 1, COVID is not gone. It will be very difficult one day to declare it gone. Vulnerable employees are at the center of the epidemic. If they weren't vulnerable employees, this epidemic would have been totally different. Remember, most people who are getting COVID are getting a nasty flu, and the rest are made up of the vulnerable persons, and that is where the mortality exists. Vulnerable employees should be vaccinated and receive their boosters. It may not protect them from being infected, but it most certainly will prevent them from getting a severe dose of COVID. And number 4, employers must incorporate that failure mode, the ones about doctors not testing for COVID as per the protocol. into their risk assessments. You must identify your vulnerable employees and encourage them to be vaccinated, and take stock of what is your immunity in your workplace. For example, persons who've been vaccinated or have built up immunity after having had COVID. The plan for returning to work must be strongly enforced. According to Section 25, COVID cases must still be reported to the Chief Inspector, Department of Employment and Labour, and also the Compensation Commissioner as a workplace disease. If an employer makes vaccination mandatory, it must be coming from the risk assessment. The South African government are of the opinion that because of vaccination, we've been brought out of the misery of this pandemic. If we look at the Biological Agents Regulation, which is the legal requirement, it states that every employee exposed to a biological agent and who is not immune to that agent must be vaccinated. So really there is a direct legal duty on the employer to require employees who are exposed in the workplace to be vaccinated or to be naturally immune. The process in the code of practice must be met. The law allows for an employer to require mandatory vaccination, but on the other hand, that mandatory vaccination is applied in a very specific process. This is not an absolute requirement, but a risk-based requirement in order to perform the current work duties. If this cannot be met, then accommodated work conditions within reason must be met. While the number of COVID-19 cases are not at an alarming rate, the public has been warned that the disease is still around. The National Institute of Communicable Diseases, the NICD, weekly testing summary indicates that new COVID-19 cases do emerge all the time. In terms of COVID-19 related hospital admissions, there has been a reduction in admissions. Delays in reporting of admissions and deaths may affect the numbers reported in most recent weeks. COVID-19 is still around, but at low levels. The reason is that 95% of the population has already been exposed, especially to the Omicron variant. For those who are not vaccinated, the message is clear. You are susceptible to getting infected. If you have risk factors like vulnerability, you can still fall very, very ill and die from Omicron. Even if people were vaccinated against COVID, they still need to avoid infections. The chance of getting long COVID is quite high. It's quite debilitating and go on for months. You have to make a call on how you want to protect yourself. It was crucial for people to adhere to health protocols like social distancing and wearing of masks when required. This also applies to other respiratory diseases like the flu. The role of employers and employees is to ensure that the workplace is safe and that they deal with hazardous biological agents. Everyone is required to ensure their own safety and the safety of others in the workplace. Every employee has legislated duties. Number 1, to comply with the employer's COVID-19 risk assessments and COVID plan and rules. Number 2, an employee must report their vaccination status. Number 3, an employee must report COVID-19 symptoms and must test if the symptoms are in place. Number 4, an employee must isolate if symptomatic and tested positive. And number 5, must vaccinate if it is a requirement in the employer's risk assessment. Let's work together on this to prevent a surge in this pandemic. You have been listening to Delene Sheesby. Thank you very much for your time.